Hello everyone, so I'm Emma, I'm from Community Action Network, so lots of faces I recognise here, but for those who don't know who Community Action Network are, we're one of the infrastructure charities in Dorset, so we're here to champion, celebrate and enable the voluntary and community sector to work really effectively together, but also with our statutory partners as well. So everything that's being kind of talked about today, we can really support you guys in exploring how that happens really. So the first thing I'm here to talk about is what everyone wants to hear about, resources, funding. So the Community Wellbeing and Mental Health Fund is really great for the sector. It's something that as a system has been being worked on over the last 2 years, and it's been around transforming the mental health and wellbeing kind of forum for adults really. And it's been a lot of partnership working, so Community Action Network have been working with NHS Dorset to develop and look at and explore what the need is and how that can kind of look like. So this one talks a little bit about what that process has been. So it's all about the right support at the right time in the right way. And I think we can all kind of agree with that. And it's called Access Wellbeing, the whole project. So the fund summary. So this is a bit that everyone wants to hear about. So there is £1 million available for groups from NHS Dorset, and CAN is working in partnership with NHS Dorset and Dorset Community Foundation to enable voluntary and community sector organisations to access this money. So there's two different types of funding. The first one is grants up to £10,000 for either a 6 to 12 months period, and there will be 2 rounds of this as well. So there's going to be one that's open at the 2nd, and then there's going to be another round opening in the summer. So if you're not ready now, you can get prepared and then apply in the summer. And then the other one is there's an £80,000 grant pot for projects that are over 2 years. And of course, you don't need to apply for the full amount, but we do ask that you apply for what is needed. And it doesn't necessarily mean that it is the same amount for across the whole period of the 2 years. It might be that you need to front load the project at the beginning to enable you to get the project up and running, and then need the ongoing costs for the rest of the year. So in terms of how CAN can support you with this, so NHS Dorset has kindly funded CAN to enable us to provide an enhanced support offer to groups, so we can support you with ensuring you have the right policies and procedures in place, that you are set up and can you're set up and that you can apply for it, so we can support you through the application process. We've got a number of people within the team that can kind of sit down with you and talk about what your idea is and how it might fit into what is already happening across the sector as well. So there's lots of support there, and I'm just aware we don't have a huge amount of time to kind of cover all the ins and outs of the fund, but please do kind of contact CAN. I'm going to be around at lunchtime, so do come and approach me if we can help. Grant from DCF is also here. He's hidden around the corner. But just grab one of us and we're happy to kind of talk to you. There's lots of information across both the websites, DCF and CAN's website. Let me just double check what else is on my slides. Here we go. Yeah, so the aims of the fund. It is very much around the support, mental health and wellbeing support rather than clinical intervention. So there's some exclusions as to what that doesn't apply. So one-to-one counselling, make sure I get the right things. Anything that's around kind of prescribing of medication and vaccinations and things like that aren't eligible. But anything else, as long as it is very much around supporting the community in the prevention of poor mental health, and you can demonstrate effectively what those outcomes are, then this fund is for you. There are I suppose the most important thing for us is that it's really keen that we want to demonstrate the outcomes of this fund. NHS Dorset have given the £1 million, and we want to ensure that this funding is potentially something that continues into the future. So we're really keen to get some really innovative, different ideas coming out of it as well. So I'm going to stop there, but please do come and grab me if there's anything that you would like to ask. Thank you.